Hi, everyone, and welcome to episode 5 of Unconventional, a limited series from us at Justice Action Network that has so far featured state and federal lawmakers, advocates, and formerly incarcerated individuals, athletes, and others who work on criminal justice reform. Today's episode is focused on COVID-19 and the impact it's had on our nation's prisons, jails, and courts. And today with me, I have Denise Rock from Florida, Kevin Ring from FAM, and Norm Reamer from NACDL. Thank you guys all for being here. So today I'm going to start with you, Kevin. FAM has a national perspective on these issues. You work in a few states, but also at the federal level. But you also work with families. You have a large network of families who communicate with you guys every day about their loved ones who are incarcerated, those who have been released during this whole pandemic. And so I wanted to see if you could kick things off and just provide a more national perspective of what you've been seeing, not only within our prisons and jails in this country, but kind of what state and local jurisdictions have been doing when it comes to releases, and also at the federal level, which I know you guys are very involved in as well during this unprecedented pandemic.
Yeah, well, sure. Thanks for having me. I'm glad to be here with Norm and Denise. You know, just to take a step back, when COVID hit, people who had loved ones in prison were just horrified. I mean, we were all as a country scared about what this meant, but they felt like their loved ones were sitting ducks. And there was no confidence that you were going to be able to keep COVID out of the prisons. And yet you had the Attorney General and others saying, you know, these prisons are isolated. They're like, you know, vessels, you know, ships. And so we'll be able to keep the disease out of there. But that's not how it works, because people are coming in and out of the prisons. So we knew it was a matter of time. And what's happened is we've seen it go from prison to prison, jail to jail around the country. And for family members watching this, they see governors find the authority to close all private businesses at gunpoint, exercise enormous authority, but then somehow find no authority to spare their loved ones from you know, prison or jail for even short periods of time to keep them out of harm's way. And then even those who, you know, say they did have the authority, they said that, you know, they didn't want to use the pandemic as an excuse to release people. And, you know, we're having this big debate in this country about, you know, mass incarceration and what's the right level of incarceration. It has been discouraging for families to see so many chief executives find that their state's prison population is optimal. It is the perfect level that they cannot let one person out or public safety will somehow be compromised. And so it's really been difficult to watch. There's been a failure at sort of all levels, I think, in response to this crisis. And, you know, I think for most people, they're thinking, well, I mean, it is an excuse to let people out. I don't think any of us would say, you know, there should be a prison break and everybody should get out. But we got to remember that 95% of people are coming home. They don't have life sentences, and they shouldn't be given a life sentence because this pandemic spreads into the prisons and they can't be safe. So the first thing that people cared about was making sure that their loved ones had masks, that the guards had masks, that, you know, there was some sort of social distancing. They closed visits, which has been incredibly tough for families to go months without, you know, touching or hugging or kissing a loved one. And, you know, our theory was just keep them safe or send them home. You know, if you can't keep them safe in there by making sure that the prisons had PPE and that the people were being protected, then release people. And frankly, it's been mostly a failure. I mean, at the federal level, we've seen Congress give the Attorney General some authority to send more people on home confinement. We have a compassionate release program that allows some people to go to court to get out. And we've seen some governors, Governor Beshear in Kentucky, use clemency authority to get people out. And in some other states, we've seen them expedite parole process. But in a lot of states, you've had governors say they're unwilling to let anybody out. And the really hard decisions have fallen to sheriffs, county officials who have tried to, you know, manage their jail populations by not seeking bail, letting people stay out, because they knew they couldn't send those people onto the state prisons who didn't want to accept anybody else. But so it's just been a failure. And I think for families watching this, it was another sad reminder that their loved ones' lives didn't matter as much, because they saw the government taking all these extraordinary measures to keep us safe on the outside, but they did almost nothing for the people inside. And so now here we are, over 1,000 deaths in state and federal prisons, later. And I still think there's a feeling of they're not doing everything they can to keep them protected.
Right. And this goes beyond just protecting people inside as well. I mean, those who come in and out of prisons every day are potentially transmitting this disease to their communities. I mean, this is really kind of a national issue, but it's not being treated as one. It's being treated as something that's just, they're siloed away. They're over here. We don't want to think about them. We don't want to deal with it. And yet, as you said, Kevin, they were able to close these other businesses at gunpoint. There's still a lot of discussion over to open schools, how to open schools, what that looks like, but they're just completely ignoring the impact that this has on communities as well, in addition to people who are obviously experiencing it firsthand behind bars. So Denise, just turning to you, your organization in Florida is in touch with a lot of people who are behind bars there. Florida has not, well, the governor hasn't done much.
Nothing.
Yeah, nothing in terms of releases. And the Florida Department of Corrections has argued that they don't have the authority to furlough individuals. And I know that your organization and also FAM's Florida director has argued to the contrary, that they do have the authority. So anyway, I'm maybe getting a little bit into the weeds here, but I'm wondering if you can provide an overview of kind of what you've been seeing in Florida and what are some pressing needs, in your state, and does it compare to other states that you've been seeing, or do you think it's kind of worse down there than in other areas?
Well, I think that we had the third largest outbreak of COVID of the prison systems that are out there. So I would say they were probably worse. But I think there are some things that we could have taken. If our governor wasn't going to reduce the prison population, he could have at least paid attention to what was going on in there. And it just, for our governor to completely ignore the system and not address the system at all, he continued to say, this is the prisons are different. They're over here, when we talk about everything else. And I think that is a failure on his part. And when families are reaching out and asking for help, yes, in the beginning, people were asking to release and reduce the prison population because doing so would help to shift people around, because our system, even though we have a lower capacity right now, we also have many less officers right now. So you're putting more people into smaller spaces. And because you're putting more people in the smaller spaces, you cannot practice the social distancing. And then once you enter that period where you need to quarantine someone, you can't actually do it any longer. But they gave up on that, and they just wanted to, see that they were and see that they were taken care of. And he wouldn't even acknowledge that part there. And so I think that was very disappointing, not to have any communication from the governor at all about the prisons. Maybe 2 or 3 words, once every 3 weeks or so. So that's very hard for the families. You have to remember that the families are, often they're like the silent victims of their loved ones' crimes. They didn't have anything to do with them either. And so I think it's very hurtful for what's happened to them, and that they feel hurt as well. And communication would have been awesome from both the governor and as well. I think the Department of Corrections could have improved some communication there. While they did good in the beginning, once things started to happen, it would have been helpful to know that this was the plan, or that you can expect that there will be greater time periods where in between feedings or things like that. or that your loved one could get in trouble for not wearing their mask, rather than just having your loved one getting in trouble for not wearing their mask.
Right. It is disappointing to just have radio silence from those who have the jurisdiction over their loved ones, and just having no clarification over what the rules are or how they're being taken care of, if they're being taken care of. I know is just so hard for so many, especially when visitation is cut and they're not able to see their loved ones in person. Norm, now I wanted to ask you, just NACDL, how have you seen changes in the court system and how everything has been handled? I know that a lot of states, I don't know if all states, kind of shut down their court proceedings in the beginning of COVID. How has that sort of panned out for defendants across the country, and also just others who are involved in the criminal justice system? And how have some states kind of reopened? What has that looked like? And what's going on with the courts?
Well,
like a mess.
That's a great question. Could take a couple hours to answer, but we only have a few minutes. So first of all, thanks for having me, and it's an honor to be on with Denise and Kevin. Look, the first thing to understand about this pandemic is that it is exposing the flaws that already existed in society in a way that no one could have ever imagined. And maybe that's a silver lining, because we are having somewhat of an awakening, I think, as we understand what the deficiencies are. And the criminal justice system leads the way. I don't want to jump into courts too quickly. I want to make a couple of comments also about the prison system. I mean, it really calls into question, in my opinion, the whole way that we approach punishment in the country. I think we have to rethink whether we even need jails. Now, I'm not suggesting that there aren't certain people that are dangerous, that are, psychopathic, or whatever the terminology might be, that may have to be separated. But the way that we do it and the numbers in which we do it are simply outrageous, unjustifiable, and frankly, a threat to public health. So I echo all of the comments about the inhumanity, the lack of consideration for the families of people who are locked up. But why are we locking people up anyway? And what is the purpose? And aren't there other ways of doing it? So that's I just had to get that off my chest, because we shouldn't even be thinking about these issues. Of course, if you crowd people into hundreds of people into a mess hall, or if you keep them in confined circumstances, you're going to have problems. And that is what brings me to getting around to answering your question, which has to do essentially with the court system and how are we functioning. So this became a concern for us at NACDL very, very early on, because of our clients, because of their families, their needs, because of our members who are practicing criminal defense lawyers who have to go in and out of jails and prisons in order to communicate with their clients. They have to go in and out of courtrooms. And so way back in April, when we had just a few thousand deaths in the country, we set up a group to look at what courthouse reopening would look like. And on June 4th, we put out a report called Courthouse Reopening and Public Health in the COVID-19 Era. And on the date that we released that report, and I'm going to just give you some of the highlights of what we were talking about and what the concerns are. On that date, there were 108,000 people dead in this country from COVID. Now, as we are sitting here today, the number is, I think it's at or over 190,000. So this problem is not going away. And I don't care what anyone in authority says, it's not going away. You talk to the healthcare people who are working in hospitals, they will verify it is not going away. You talk to the funeral directors, it is not going away, okay? So we are in a situation where we have to figure out, how do we have a justice system functioning in an era when it is unhealthy for people to be in close proximity to one another? And that is the challenge that faces the court system. The short answer to your question, Lauren, and by the way, I just got off a conference call with the task force we have that's looking at these issues, literally just before coming on this program. And just from anecdotally from the 8 or 9 lawyers from around the country who are part of that task force, it is, I guess the phrase is, it's the Wild West. Everybody is doing something differently. There's no coherence to what's being done. And there's very little deference to medicine and science. And so you have situations where, first of all, I want to acknowledge one thing, that there is an inherent tension between the needs that exist in a society that's experiencing an epidemic and constitutional rights. And the rights such as the right to confront and cross-examine witnesses, the right to a public trial, the right to a speedy trial, the right to effective counsel. All of these rights in some ways are at risk of being compromised. And we, speaking for the defense bar, we understand that accused persons themselves will have to make some choices. Okay, if going forward in a trial is going to come at the risk of the health of your client or of witnesses or of lawyers, judges, prosecutors, it shouldn't go forward. That's as simple as that. Now, is that a tension between the right to a speedy trial and the right to a safe trial and to all the safeguards that go with it? Yes. So people will have to make choices. But the first principle should be that medicine and science should prevail. And we ought not to be throwing people into closed rooms for long periods of time with an airborne illness. Now, some people will say, well, you can use masks, you can use dividers. Well, we got expert opinion, and the experts say, yeah, those will minimize risks, but they don't eliminate risks. The longer you are in a closed space, unless you are completely within an enclosed tube, droplets are going into the air and they are circulating in the room. And we've already seen cases where they've started proceedings and they've had to cancel them because jurors have gotten sick, lawyers have gotten sick, and we will eventually see death. So the need here is to take a step back and think very carefully about how you proceed in this kind of an environment. And I want to make one other point, then we'll have to have a discussion about a lot of these things, but also bear in mind that one of the most fundamental rights is to a jury that represents a fair cross section of your community. Well, we know that this disease is not affecting communities equally. It is having a disparate impact on people in low-income situations and on minorities, people with pre-existing conditions, people who are living in very close quarters. And so what happens when those people get summoned for jury duty? Are they going to go? Are they going to be excused? I have heard of jurisdictions where the clerks are basically saying, if you feel you're at risk, don't come to court. You're excused. Well, what does that do to the right to have a fair cross-section of the jury hear your case? It's out the window.
Absolutely. And I think, I mean, you raised a lot of points that I kind of want to piggyback off of and just kind of open this up to the group here. I mean, one of the things that you raised that stuck with me and it is going to stick around literally is the fact that this is going to be happening for a very long time. Look, I mean, we don't know when a vaccine is going to come out. The idea that it's going to come out before the election is a joke for anybody you've talked to. I have a doctor in my family. He has no idea if it's even going to be ready next summer. Now, and everybody seems to think like once we have a vaccine, things can get back to normal. Well, if we don't know when that's going to be, that means it's not going to be normal for a very long time. And yet when we're talking about the justice system, I think that there's still this sort of, there's this perception that it's temporary, like this is just temporary right now. Well, what does that mean for families and people who are behind bars who aren't going to have access to programming? They haven't had access to programming because it's been suspended in every state that has kind of gone in lockdown since COVID. And if you're not able to access programming, often that comes with earned credits. That means you're going to be sitting behind bars for longer. You don't have access to visitation with your families. Not every state has the ability to do video visitations. And if they do, it's quite exorbitantly expensive. So I would like for you all to kind of comment on just what does this no end in sight kind of expose about just how unprepared our justice system was to handle this, and how continuously unprepared they are to handle this in any long-term sort of fashion, which is really what we're looking at here.
I would like to jump in and just say, by the way, that one of the things that if would help tremendously is if the Department of Corrections would come at least to the internet century, because of the fact that they don't, we cannot continue programs or any meaningful video consultation of any kind, because the current video visitation connection that you have with your loved one is not the quality that you are seeing here today. It is a much poorer quality. It is probably something that we've saw 15 years ago here, okay? So you're not seeing the same quality connection. And then also, because we don't have any capability of having any internet connection, you can't have any type of programming. But if any Department of Corrections would embrace that, you know, we could have a video education or something like that. And if the pandemic continues and if the situation continues, then there could be that possibility, you know. And I recognize that there's concern there, but there is security concern with everything. And I'm sure that if, you know, the very smart people put their heads together, they could find a way to address having the internet in there. There is the internet in there. There's the internet in the officer station. So I think that we could figure out how to get the internet to be able to have a Zoom with the incarcerated individuals to give them instruction and to give them a meaningful, you know, time with their family if you're not going to allow their families in to see them, because what they're getting right now is not meaningful.
Yeah.
Well, go ahead, Kevin.
I mean, I think that's where you're right. In Pennsylvania, they're using Zoom, where they were, and people were getting longer visits. I want to take 1 second to extend some charity to the bullies or the other side that we have built up here. You know, this is a hard situation for everybody, and I think, you know, corrections officials are in a tough spot in how to deal with this. They know they can't do social distancing. They didn't choose this situation of overcrowding. I mean, they come to work, you know, they're guards, they're administrators in these prisons, and they didn't set the rules that created the population. They don't want to get sick. They don't want to bring the disease home to their loved ones. So, you know, there's more commonality there than sort of us versus them. And I think it's, as Norm said, that this has just exposed a problem in the system, which is a complete lack of transparency. So many of the problems we had early on where families just wanted to know what was going to happen. I don't think they expected everyone to get out, but they didn't know if there was testing. They didn't know how many people were being tested. They didn't know what the results were. They didn't know what the guidelines were for possible release. And so you created a lot of inordinate fear that you didn't need to have if they had better communication. We just don't see enough prison officials be transparent about what they're doing, what they're trying to do. I mean, I've talked to, you know, correction department heads. They've lost a lot of staff. So they've got wardens hand delivering meals and styrofoam boxes and all the rest. And I think people could have some grace for the people in that situation if they knew what was going on, but you don't even know how many guards are out sick or being quarantined or leaving. And so we create this impossible situation where for the families, you feel like something is being done to you. You know, early on, they understood that they couldn't have visits. They were gonna have to forego being with their loved ones to keep everyone safe. But there was just no sort of plan set out as to what were going to be the metrics by which you were going to decide whether people go back. And even among families now, they're starting to open visits, and half the families don't want it because they think their loved one's going to get sick. Half of them do want it because they want to see their loved ones. It's complicated stuff. And so I don't want to just throw, you know, these DOCs under the bus and say they're doing everything wrong. I think they're in an impossible situation. I just think our leaders, though, our legislators, our lawmakers, our governors who have the ability to actually make the decisions about population size and everything, they're the ones who have punted and left the corrections officials holding the bag in a really difficult time.
Well, I think I agree with that. It's just another reflection of a system which, from top to bottom, is essentially broken. We over criminalize, we over prosecute, we over incarcerate, and so we have these situations which are unmanageable. As Kevin says, they don't like that they're in that position. They're dealing with it perhaps the best way they can. But the problem is that the tone that we've set is one of, it's a harsh tone that puts a high emphasis on being punitive. So to Denise's point, of course they should have internet. They should have internet not only so that they can communicate with their families on a regular basis, whether or not there's a pandemic. They should have internet so that they can be learning and growing and preparing to re-enter. But we don't, we just for too long have treated, once you get that conviction, you're like you're a non-existent entity, and one that's not deserving of any support, any guidance, or any real help.
I'm trying to figure. We don't have a lot of time, and I have way too many questions, and I would love to do this forever. So I'm trying to figure out how to organize this. But I think I'm going to shift gears and try to be focusing on something a little bit more positive, which is hard to do with this really difficult conversation. But one thing that we have seen that has been positive has been primarily at the local level and also the federal level. As Kevin and I were talking earlier, there is a mechanism for release at the federal level. A lot of states just don't have that mechanism. It either is they're reliant on clemency by the governors, or just the local jurisdictions are the ones who have that authority, because most of the people who are incarcerated at the local level are pretrial. But in places where we have seen some releases happening, for example, just off the top of my head, Tennessee, they've seen their local jail population fall 30%, and they've also seen a reduction in crime. In Kentucky, their jail population has dropped 30 or 40%. Now they're going to see high percentage reductions because they had a higher percentage of their jail population there pretrial, and therefore, low-level nonviolent offenses. But still, for states that have not yet really engaged on those issues, like pretrial reform or trying to actually address this in a systemic way, it has gotten some local leaders, sheriffs and others, to start thinking about who really belongs in their jails, and do we need to house everyone who is here. And at the federal level, you have seen compassionate release applications granted for some people. So I want to see if we can talk about how that has worked, and also whether or not this is something that you see as sort of a long-term, like if this is going to be something that is placed in statute, because we're talking to some people who are saying that, this has actually been pretty positive for my jurisdiction. I don't know if I want to fill my jails to the capacity that they were filled before. So I'm wondering if you all could kind of touch on whether or not you think that this is something that you'll see stick around long term, or if this is really just kind of a temporary thing, and we're probably going to swing back to where we were before after all this.
Well, you said you wanted us to be positive.
Sorry.
No, look, necessity is the mother of invention. This, in some jurisdictions, you're right. This crisis had the ability to show us we could do things differently and have it work. So at the federal system, right, you have 40,000 people who are in federal prison camps with no fences around them. And there have been people who have saying forever, why are they even in prison then? Why couldn't they be home on ankle monitors or in community confinement? The Justice Department has used the authority Congress gave it to extend home confinement down to over 7,000 people. We're not going to see high rates of recidivism. We're going to save money. We're going to realize those people didn't need to serve their time in prison. Compassionate release, although the Justice Department is fighting a lot of those releases, they're going to save money. They're not going to worry about public safety when you have the 1,400 people this year who have gotten compassionate release. And as you mentioned, some of the local examples. So this could have been, and I hope we still do, use some of this experience as a test study to say, why would you go back to that? Now, there's some jurisdictions where they're doing nothing and we're going to learn nothing because that punitive streak is still there. But I agree with you. If we're smart, we will grab some of these examples and show that we could do things differently.
Denise, would you care to talk about, I think what's really interesting and why I wanted to have you on, it's just Florida has been so punitive. A number of conservative states have passed reforms in recent years. Florida has always lagged behind on any meaningful sentencing reform whatsoever. And yet in a couple of counties, there have been a couple of DAs there that have have released certain individuals, many of these individuals who are actually serving longer sentences now than they would have if they were sentenced after the change in the law in 2014. Can you talk about how that has come about and whether or not you think that that's going to be sort of a long-term program that some of these counties potentially, keep on?
Sure. So that's come from some, organizations, and going to the prosecutors, which I think was, just a phenomenal idea on some of the laws that have changed since, and yet people are still stuck in there. And, the prosecutors are looking at those files and, actually have released some of them, not all of them. I think like in Dade, for example, I think there was 37 people that were stuck on the drug resentencing. Maybe I think they're up to like 4 now or so that they've released or so. And in Broward, that prosecutor's retiring and he's going through his cases, and I think he's got 45 or so. And I can think of 3 or 4 that he's done, or maybe he's done about 5 now. And then we have Orange County, she's retiring. And so, that she's looking through her files. And so, yeah, I think that you do have some prosecutors that are looking back, before they leave at, what they've done, and looking at the people's sentences and maybe what they've been doing themselves in prison. I think that's a good sign. I think it opens up the conversation for us to start thinking differently. Like, don't be afraid to go back and talk to a prosecutor. Maybe there's hope for second look legislation, because that's kind of along the lines of taking a second look, and maybe there's hope for the aggravated assault people. There's to take that back to prosecutors as well. I think that for us in Florida, there's not going to be a whole lot of sign a retroactive bill and let's release a group of people. I think that people are going to we're going to get them out one by one, by a prosecutor maybe looking over their case, or a judge looking over their case. But it's possible. And I think that gives people hope.
Yeah, and I think it's so important right now, especially, some of these cases that we're talking about of people who were released, Florida changed their one of their drug sentencing laws in 2014 and made the sentences shorter. But everyone who was sentenced under these punitive laws before had to continue serving their sentences. And there are dozens of people who are over the age of 60 even, for example, who have served 20 years when if they were sentenced in 2014, they would have only gotten 7, which is still too long for some people. And so it's interesting that prosecutors are now kind of looking at these cases and saying, oh, can we maybe release some of these people? I think that's unprecedented in Florida, but it certainly shouldn't be, and it shouldn't be in other places as well. So I guess again, I could talk to you guys forever, and I really wish that we could, but I'm just going to end with this question, which is something that stuck with me since Norm raised it originally, is that COVID has really kind of exposed how we approach punishment in this country, which is largely just arbitrary. Why were those people who were sentenced before 2014 having to serve every single day of that mandatory minimum sentence, whereas people who were sentenced later, so 7 years? How do we choose these numbers? How do we choose who goes to prison? And what do you guys think that this has really exposed about how arbitrary our justice system is in this country? Andrea Highbear, who was sentenced in the middle of a pandemic to federal prison, and she ended up dying in federal prison. And there's hundreds of other people who are like her. So yeah, this is not the most positive note. Maybe I should have chosen the last question as my last one. But I'm wondering if you guys can all talk about whether or not you think that the changes that have been instituted in some of these local jurisdictions and the changing mentality of some of these prosecutors, like you've seen in Florida, is going to actually serve as a catalyst for a reckoning of just how we approach punishment in this country, or if you think that this is just a temporary thing, people are scrambling for solutions, and you take a more pessimistic view. Please, I set you up, so please feel free to take that pessimistic view, and I'm sorry that that's how we'll be ending, but this is
let me say this, Lauren. I think that we were actually on a good path with criminal justice reform. We've seen groups from the left and right come together over the groups like your own, in fact, you know, that are bringing different voices into the mix. And I do think that I'm optimistic long-term that we're going to see a lessening of reliance on prosecution and incarceration, and a greater trend toward investing in mental health, addiction services, and a lot of the contributors that bring about crime and bring about prosecution. And I think there's the possibility that the pandemic and the response to it will help that along. I think the data is going to be, as Kevin was suggesting, we're going to see very, very low recidivism rates amongst the people who have been granted their release as a result of these, emergency measures, or the extension, if you will, of the First Step Act into applying the compassionate release provisions to people who are at risk from the disease. But I do have this cautionary note, which we tried to cover a lot in this discussion by looking at the whole prison and punishment thing, but also bringing in the whole court system. And what I want to say about that is technology can be a wonderful thing. And I would love to see much more of it in many different ways, particularly for people who are incarcerated. But I am very concerned that any of these special measures that are being used now in this pandemic not end up supplanting fundamental rights. We cannot have virtual trials. That is a misnomer. It is a denial of fundamental constitutional rights. We cannot have proceedings taking place where people are not fully visible, and where people can't see a person's face and judge their credibility. Those are things that we can't allow to slip away as a result of this pandemic. And I am very concerned because time and time again, we see efficiency becoming more important than fundamental rights. That's how we got into a system where we don't even have trials anymore. Everybody is basically strong-armed into pleading guilty under pain of getting increased punishment to move cases along, because heaven forbid we actually take the time to consider a case. So I think there's a reason to be optimistic that there are good things that have been learned, but I think we have to be very cautious about what we institutionalize as a result of the pandemic.
Yeah, along the lines of what he said, there are no virtual trials. There can't be video visits forever either. I mean, families have to, I was in prison for a short time, but I mean, I needed my kids there. I needed to hug them and touch them. And that is what sustains you. We're social beings and we need that. And so I think people can accept that for, in a pandemic, but at some point we have to make sure that we're doing everything we can. I'll say the challenge for us, the system was exposed for not having mechanisms to reconsider sentences and get people out. So now the burden's on us to say, the system's been exposed. In the health field, they're talking about, this is a warm up from a much worse pandemic we could face down the road, right? And so if we don't learn the lessons and create these mechanisms now so that the mortality rate of this disease has been relatively low. We could have a disease that's much higher. And how would we deal with that, right? So it's on us now as advocates to create these mechanisms to work with lawmakers. But I will also say the challenge for us too is we have tension in our movement about, we want better trained corrections officers, better meals. We want more training, which requires people in there. We want video visitation, and we want computers and things that people don't have to pay for. Are we fighting for investments in prisons? No, because we say we want to starve the beast and force them to reduce the prison population, and then we can pay for that. But it's a chicken and egg game going on right now. So we say those things are critical, but our prisons are being starved of resources. And we say, well, the solution is reduce the population. But until the prison population is reduced, what are we going to do? People are going to be struggling for these resources, getting terrible meals, no rehabilitation programming, and all the rest. So I think we have to figure out, sort of some long-term goals that we all have towards decarceration. But in the short term, are we willing to accept incremental progress to get to that larger goal? And it's on us now. We know that these systems don't have political will. We have to try to fix that through elections, but they also don't have mechanisms, and we have to change that through reform.
Absolutely. Well, I know I said that was going to be my last question, but I'm just going to have each of you spend 30 seconds answering this question, which is, if you could just choose like one or two things that you need to see right now in order to make the situation better in prisons, either from the federal government or from state level, what would that be? And I know you probably have 10 or 20 things that you'd like to see. But I know some of the things that are talked about at the federal level right now are trying to get state and local funding for jurisdictions that are safely reducing incarceration, expanded elderly and compassionate release. And I know another one was, SBA loan access to people with criminal records. They were completely kept out of that opportunity when that was around. So I know that those were a few things that were floating at the federal level. You don't have to choose those things, but I'm wondering what you think would be the biggest thing that you would like to see right now. 30 seconds go. Norm, we'll start with you.
Okay, very easy, very simple, very doable. We should have 100% testing. And related to the COVID situation, we should have 100% testing of every single person who's in a jail and prison in this country, and it should be done on a regular basis. No excuses not to be doing that.
Clear and concise, and I 100% agree. Kevin.
Well, I'm going to go beyond just COVID. We need alternatives to incarceration. We need the idea that prison does not have to be the first option for everybody who breaks the law. And recognize that the reason we have this massive incarceration rate that we do have is because we overuse prison. Some people do need to be there, in my view, but we clearly overuse it. We don't need to send everyone we send there. The people we send there, we don't need to send them as long as we do. And so we need to do more work on getting people to understand that you can hold people accountable. We can get our pound of flesh without putting everybody behind bars.
Absolutely. And Denise, on with you.
So, well, for me, I think the one thing that we need is we need an oversight board, a collaborative board, to be citizens from the public to participate within the Department of Corrections.
100%. I mean, I 100% agree. Well, like I said, I could keep talking to you guys about, this was a big topic. We could talk about this for hours, each individual component for hours. Really, really appreciate all of your time though. And I'm really honored to have been able to moderate this discussion with such powerhouses in each of your fields. Mm-hmm. So really appreciate it. Thank you so much, Norm, Kevin,
Thanks.
Denise, and our audience for being here and paying attention. Thank you so much.
Thank you.